Okay, shifting gears again, let's switch on to NSAIDs. NSAIDs is the abbreviation for non-steroidal anti-inflammatory drugs. And if you go down your retail pharmacy, you'll find yet another entire aisle full of NSAIDs. NSAIDs turn out to be one of the most dangerous drug classes for older adults. And unfortunately, these drugs are extremely commonly used by seniors. And they use them for things such as things you would expect with the aging process: joint stiffness, arthritic and muscle pain. Mom takes a leave until Don, the pharmacist, got a hold of Mom and said, "We're not letting you take a leave anymore." This class of pharmaceuticals is available in both prescriptions, such as ibuprofen, naproxen, Celebrex, and readily available on over-the-counter as Advil and Aleve. NSAIDs are also often the ingredient of many cold and sleep preps, thus compounding the issue of NSAIDs even further. Okay, so the problem with NSAIDs for seniors can be absolutely, unequivocally life-threatening. They include gastrointestinal irritation leading to GI bleeding and death, platelet function or prolonged bleeding time, blood pressure elevation, the risk of heart attacks and stroke. In fact, the FDA just recently revised the guidelines on NSAIDs and gave a specific warning regarding NSAIDs that you increase the risk of heart attack and stroke. Geriatric patients are at an increased risk of NSAIDs adverse effects, and the reason for that is that in the senior population, the body is very, very frail and fragile. And if they're taking NSAIDs, they're absolutely more prone to develop a GI bleed. And those GI bleeds don't go well, and usually when I find a report in the medical record of a fatal GI bleed, sure enough, there was an NSAID on board. So older adults should not be taking NSAIDs. They should be dropped from the profiles. And there's also many non-NSAID analgesics that are readily available that work just as fine but without the risk. So what do you take? I highly recommend arthritis strength Tylenol or acetaminophen. That's 650 milligrams, 3 times a day, the extended release one. Works beautiful. If that doesn't hold the pain, then there's nothing wrong with something like Ultracet. Ultracet is a combination of tramadol and acetaminophen. It works beautiful, and you reduce the risk of going to things like opiates, which you don't want to do. Tramadol by itself is also an excellent pain reliever and provides arthritic relief as well. So GI bleeds, very, very severe and usually life-threatening in someone in their senior years.